Morning, morning, morning. Good morning. Good morning to you.
We are graciously joined by Dr. David Callendar, who is consultant head of the Department of Ophthalmology at the Queen Elizabeth Hospital. Good morning and welcome. Good to have you with us.
Good morning, thank you.
Happy World Sight Day, first of all.
Thank you very much.
All right, what does it mean for, from your perspective, first of all, to be able to have an observance like this? Because a lot of people look on, and these days it feels like, okay, there's an observance every single day, but what does it mean to you to be able to have an observance like this in the drive to really get people to be far more in tuned with how important it is to take care of themselves when it comes to their eyesight?
Okay, World Sight Day is a global event meant to draw awareness to blindness and vision impairment. Those of us who work at the hospital see the end results of lack of eye care. If you can at least have the opportunity to observe this, we draw attention to the public of conditions that can affect vision and health of the eyes, then it serves as a way of preventing some of the things that we have to try to fix. The theme this year is Love Your Eyes in the Workplace. However, we are not focused on that at the hospital this year. There are other players who are involved in that outside. This year we are focused on children. Last year for World Sight Day we did a blitz on cataract surgery, dealing with adults. But this year we were focusing on children because we find that a lot of kids present late and the opportunity to improve or reverse eye conditions may be lost. So the focus this year is to try to screen those kids who may have fallen through the net or fallen through the cracks and capture them before they get too old.
I know there are a number of programs, but they're kind of privately driven, where there are maybe third sector organizations or charities or what have you that go into schools and try to do screenings. Do you believe that we do screenings enough for children to be able to figure out what's happening early on in life?
No, we do not. We have a school eye clinic based at Winston Scott Polyclinic for the past 50 years. And we see children who are referred by school teachers who seem to think the kids have a problem. Of course, that does not capture everyone. There are some kids who go through school without having their eyes checked at any time. For example, if a child is very nearsighted and they sit close to the class, close to the board, there's no way of knowing that they have a problem. They can see the board fine. So we may not capture those kids by referrals alone from school teachers or from parents. So what we aim to do in the long term is to screen children before they start school or within the first year of school. On this occasion, we are screening first formers, as many first formers as we can, to capture them as soon as they're going into the secondary school. We chose first formers because we have a database of them, all the information, demographics, and we're trying to capture them before they get too far into the secondary education. Because if they can't see well, then it has implications for the education. And there's some conditions where if you don't try to reverse them early, it can leave you with blindness in one eye. There's some jobs you cannot do. There's some things you can't perform if you can't see well from one eye. So we're trying to capture them at this stage. And as we go forward, we're hoping to start screening children early in their school career. For example, first year of primary school. We are aware of the challenges that will exist, but we're hoping to deal with all those as time progresses. So it's a work in progress.
All right. So as head of ophthalmology, how do you see the current state of just eye health in Barbados generally, as we look across, the whole of Barbados, from young people through to older people?
We have a lot of eye problems here. Deal with children first. We have lots of kids who are nearsighted. Many need glasses. There's a serious problem with allergic conjunctivitis or eye allergy, especially during the summer months when we have Sahara dust. We also have a challenge with many patients who have misalignment of the eyes, or we call cross eye. Those are the three main things we see in children. Because of our diabetic population, we have lots of diabetic retinopathy. And the need for treatment of this condition is significant. I don't think we have enough medical resources to manage the problem adequately. There's also a lot of talk about cataract. We have a lot of cataract for sure. We have many cataract surgeons in Barbados. I don't think that we really have a difficulty with that. There are long waiting lists, yes, for various reasons, and we tackle that list on an ongoing basis. But those are the things that we have mainly. And glaucoma itself, which is more of a irreversible cause of blindness, that's a big problem also. So we have lots of these things to deal with on an ongoing basis.
I know that there are certain things we talk about a whole lot more when it comes to healthcare, and these days it certainly is a whole lot more glamorous, if you want to call it that, or the buzz phrases of make sure you get your prostate checked, check your blood sugar, check your blood pressure. These are things that almost come naturally now for us to say, but we don't often hear people talking about when you should check your sight, how often you should check, that you can see well. I know that you're not focusing specifically on the workplace, but looking at how sitting and looking at a screen can impact us, I would imagine for long periods, particularly in the workplace. That's what we're doing. We have the children online a lot over the last few years. So what are some of the key markers, like how often should you have your sight checked, or what are some of the indicators that you should have your sight checked, and who should you go to? Because you hear of the optometrist or the ophthalmologist and this and that. Who should you go to, and how often should you have it done?
Well, there's no doubt that with the recent pandemic and the use of devices for online school, the incidence of nearsightedness has increased worldwide. There are studies to prove that. So the constant close-up work has caused more kids to need glasses. As far as adults are concerned, most adults may not need glasses until they reach around age 40 because of changes that occur in the eye. Persons who spend a lot of time on computers for the nature of their work eventually will need some help to see close-up or near. So we always recommend that you should get your eyes checked regularly, especially if there's a family history of glaucoma or if you're diabetic, maybe once a year. If you're using devices a lot, once a year is useful, at most twice. Children, as they're growing, should get their eyes checked, I think, once a year, especially if they wear glasses, because as they grow, they get more nearsighted. And the annual check is useful. Even if you don't wear glasses, it is still useful to get your eyes checked at least every 2 years. We have some fantastic eye specialists in Barbados. We have optometrists who are not medical doctors, but they have a vast knowledge of what goes on in the eye, and they're very good at diagnosing eye conditions. We have the ophthalmologists who are doctors, eye surgeons. You can get your eyes checked by anyone that you're comfortable with. If an optometrist sees a medical condition or a surgical condition, they will refer to the eye doctor. And if you already see an eye doctor and you're comfortable, there's no harm in staying there either. The optometrists are very good, and if they find a problem, they refer. As far as children are concerned, a lot of these kids who may need glasses, if they're below the age of 7, may need to see the eye doctor because they need to be tested by different techniques using eye drops. And we also have an orthoptist who screens the children of Vincent Scott. That's another branch of the specialty. And she looks after all of our patients with misalignment of the eyes, as well as what we call lazy eye. So all three work together to provide the service here.
All right, what generally would be your message to Barbadians on this World Sight Day?
Pay attention to your eye health. We've talked about it for a long time. If you're diabetic, you should get your eyes checked at least once every year or 18 months maximum. If you have a family history of glaucoma, you should get your eyes checked every year, and you should get your children's eyes checked regularly.
All right, that's important to do. He's talking to me, people. I hear it loud and clear. I definitely need to get my eyes checked as I approach a significant birthday. He called a figure, and I definitely can feel it. Yeah, I can feel the difference. I used to brag that I had 40/40 vision.
2020.
Not anymore. Well, I said, I have 44, just joking around, but I can definitely see the difference, no pun intended. But I hear you, we definitely don't pay enough attention to our eyes.
I think it has that attention has increased over the past 10 years, I think. Every March we have a week called World Glaucoma Week. And there's lots of information that goes out at that time, so we do get a lot of buy-in then. So I think the increased awareness has been definite.
It's growing.
It's growing, yeah.
It's growing. Good stuff. This is Dr. David Callendar, Consultant Head of Department Ophthalmology at the Queen Elizabeth Hospital, giving us some great insight on this World Sight Day. We're going to take a break because today is another observance as well. It's World Arthritis Day. Seems like it's World Getting Old Day. I don't know. Arthritis is not only for older people, so let me not say this. But we're going to have Dr. Jerry Warner coming up after this.
Morning, morning, morning. Good morning. Good morning to you.